Is Joanne Emerson here? There you are. Good to see you, Joanne.
Thank you very much for having me here today, and thank you very much for your passion on this issue. Coming from a very rural, poor district in southeast and south central Missouri, I have so many constituents who have no insurance, nor do those who have insurance necessarily have access
to providers.
Particularly primary providers. And so for us to be able to get together, all stakeholders, members of the House, Senate, Republicans, Democrats, business, labor, you name it, I think that's critical. And I hope that all of us from both parties will be willing to kind of take a fresh look and say, you know, if there are laws that we had on the books before that they need to be opened up if we need to change the system. And I think all of us have to be willing to kind of give a little, if you will. And I thank you so very much because, for me, this has been a passion for all 13 years I've been in Congress.
Good.
Thank you.
Listen, I appreciate your point, Joanne. I want to amplify it. I think it is so important that all of us make decisions throughout this process based on evidence and data and what works, as opposed to what our dug-in positions may have been in the past. Because if we can at least agree on a set of facts, we're still going to have tough choices, but we're more likely to make good decisions on behalf of families. And so I want to be clear about my own position in this process. During the campaign, I put forward a plan for health care reform. I thought it was an excellent plan, but I don't presume that it was a perfect plan or that it was the best possible plan. It's conceivable that there were other ideas out there that we had not thought of. If there is a way of getting this done where we're driving down costs and people are getting health insurance at an affordable rate and have choice of doctor, have flexibility in terms of their plans, and we could do that entirely through the market, I'd be happy to do it that way. If there was a way of doing it that involved more government regulation and involvement, I'm happy to do it that way as well. I just want to figure out what works. And that requires us to actually look at the evidence and try to figure out, based on the experience that now has been accumulated for a lot of years, how can we improve the system? And I'm absolutely confident that there's going to be some low-hanging fruit. For example, the issue of health IT. I don't think there's any dispute between Newt Gingrich and Ted Kennedy that if we digitalize our health care system, we're going to save money over the long term, and we're going to reduce error and save lives. There are going to be some other areas that's not such low-hanging fruit, and there's greater dispute about what might work. But we have to keep that open mind that you called for, Joanne. That's going to be critical. Let me go to Max Baucus and then Chuck Grassley. I want to